What should a good ADHD assessment involve? I'm Dr. Livia Pontes, a clinical psychologist and neuropsychologist, and I'm seeing a huge increase in women in their 40s seeking and receiving ADHD diagnosis. And while this increase is incredibly important and can be very positive, we also need to make sure that assessments are done in the proper way. ADHD is a neurodevelopmental condition. This means that a good assessment needs to include a detailed clinical history. The professional needs to take time to understand what were you like as a child, what happened at school, when did these difficulties begin, have they been persistent, and have they affected different areas of your life. There also needs to be evidence that the symptoms were present before the age of 12, and they need to have been present for at least 6 months. A good professional will also gather information from somebody who knows you well, perhaps a partner, a spouse, or family member. In the case of a child, we usually want information from parents or caregivers and teachers as well. Questionnaires can be very helpful, but a good assessment shouldn't simply be you completed an online questionnaire, you scored high on a computerized test, therefore you have ADHD. As a neuropsychologist, I find that a full neuropsychological assessment or cognitive testing can be incredibly helpful because it helps us to understand a person's individual cognitive profile, not only where they're struggling, but also their cognitive strengths. But I do appreciate that a full neuropsychological assessment can be quite expensive and time-consuming, and it's not the only method for reaching a solid ADHD diagnosis. Whatever types of tests are being used, they need to be thought out carefully because some can be quite artificial. For example, if I ask you to sit in front of a computer for 40 or 50 minutes watching repetitive stimuli and pressing a button whenever something happens, plenty of people without ADHD will become bored, disengaged, and distracted. So whatever test is being used, it can't be interpreted in isolation. It needs to be combined with a detailed clinical and developmental history and information gathered from different sources, not only the patient. We are seeing enormous growth in ADHD assessment services at the moment in the UK, but not all services are created equal. A diagnosis is something very important that needs to be done carefully. When it's accurate, it can be incredibly helpful and it might be the path that leads to someone finally getting the help they need. But an inaccurate diagnosis can be very harmful. Women in their 40s deserve careful differential diagnosis so we can understand if the difficulties are part of ADHD, whether they may be symptoms of perimenopause, or whether both might be present at the same time. If you found this information helpful, you might also like my 6-week program where I'll teach you practical ways to manage these types of cognitive difficulties during perimenopause and no other difficulties. The link is in my bio. And if you found this post helpful, please save it and share it with a woman in your life who might need it.